everyone, my name is Kelsey Grabeel, and I'm an associate professor at the Health Information Center Preston Medical Library here at the Graduate School of Medicine. Today I'm going to talk to you about health literacy. Health literacy has long been defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information services needed to make appropriate health decisions. In simpler terms, it involves knowing how to find information, evaluate it, and use it in regards to health in everyday life. This has been the longstanding definition and is also the definition that was included in Healthy People 2010 and 2020. However, in Healthy People 2030, the U.S. Department of Health and Human Services updated the definition to include personal health literacy as well as organizational health literacy. Personal health literacy has remained the same in that it is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. The new definitions emphasize people's ability to use health information rather than just understand it, focus on the ability to make well-informed decisions rather than just appropriate ones. They incorporate a public health perspective, and they acknowledge that organizations have a responsibility to address health literacy. So now that we've gone over what health literacy is, let's look at health equity. Health literacy and health equity are related concepts. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. Achieving health equity means giving people what they need to be as healthy as possible, but different people need different things. How do health literacy and health equity relate? Health literacy principles make information clearer. Health equity principles make it more inclusive. Organizations that carefully consider both when designing and developing communication products will more easily realize their communication objectives and achieve success in their public health interventions. Another topic to review are social determinants of health. Social determinants of health are the conditions and the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. People's environments affect their health. Examples of social determinants of health include access to educational and job opportunities, healthcare services, and green space, exposure to racism, violence, discrimination, and pollution, availability of nutritious foods, physical activity opportunities, and social support, options for safe transportation, housing, and neighborhoods, and skills in language and literacy. How do social determinants of health relate to health literacy? Healthy People 2030 lists health literacy under the social determinants of health domain of healthcare access and quality. People with lower health literacy are at a higher risk for poor health outcomes, like more hospital stays and emergency room visits. Social determinants of health affect health literacy, which in turn affects health. For example, people with low incomes and low education levels are likely to have low health literacy. This could mean that they're more likely to have poorer health outcomes. Health literacy is a problem across the country, so now we're going to discuss its impact at the national, regional, and local levels and the factors that influence health literacy, such as education and age. According to the Office of Disease Prevention and Health Promotion, there are 4 levels of health literacy. Proficient is the highest level, and it means that a person is proficient in their health and healthcare. For example, patients with proficient health literacy can use a table to calculate an employee's share of health insurance costs for the year. Intermediate means that patients can often understand and apply medical information specific to their health condition, but not always. They have a mid-level of understanding of health and healthcare. For example, patients with intermediate health literacy are able to read instructions on a prescription label and determine what time they should take their medicine. For patients with basic health literacy, they may be able to read a more complex document, but interpreting or applying that information might be more difficult. Patients with basic health literacy might be able to read a pamphlet and determine their body mass index, but might not be able to determine if it falls in the acceptable range. Below basic health literacy is the lowest level, and it means that a person might not be able to locate information in simple text or read a short set of instructions. For example, patients with low basic health literacy might be able to pinpoint the time of their next appointment from an appointment slip, or they might be able to identify what they can drink before a medical test. This is a statistical representation that displays the levels of health literacy in the United States. About 12% of the population throughout the United States has proficient health literacy, meaning they're proficient in their health and healthcare. 53% have intermediate level, 21% have basic, and 14% or nearly 30 million people have below basic health literacy. This means that a little under 90% of adults in the United States are not proficient in their health and healthcare. And this is a map examining the health literacy levels in the state of Tennessee. Green indicates proficient levels of health literacy, the dark green, while red represents the below basic levels of health literacy. So as you can see, the majority of the state falls into that orange, which is basic health literacy. It is important to note that literacy does not equal health literacy, though there is a strong correlation. Health information can overwhelm even people with advanced literacy skills and high levels of education. So this chart does a great job depicting adult health literacy in relation to education. As you can see, of those that have not completed high school, 49% will most likely have below basic health literacy. But even with a high school diploma or a GED, 44% will still most likely have basic or below basic health literacy. So the higher the education level, the lower the percentage of basic or below basic health literacy. However, some people have basic or below even with a bachelor's degree or higher. And those with a bachelor's degree or higher, the majority falls in the intermediate level, meaning they are not proficient in their health and healthcare. So low health literacy affects all people regardless of their education level. Age is another related factor to health literacy. As this graph shows, we see an increase in low health literacy with age. Those that are older than 75 have a 70% chance of having basic or below basic health literacy skills. Given the high number of low health literacy rates, there is a high probability that you will encounter patients with low health literacy. However, you can't always tell. And patients with limited literacy say they feel shame and they hide their limited reading ability from others. So this video does a really great job of looking at health literacy from the patient's perspective.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess the doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know what this is.
Twice?
Twice daily.
Okay.
Okay.
So how would you take this?
When I see it's not on there telling you how to take it. It says take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered. Hypered.
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure. Okay. But hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think I think you're jumping around on the chair or something like that. Something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
So that video does a great job of looking at health literacy from the patient's perspective. And next we have another short video, Dr. Lisa on the Street. And it's from a larger TED Talk by Lisa Fitzpatrick called, Are You Confused About Health Information? You're Not Alone.
Often speaking a language that people don't understand. Has this ever happened to you?
Pretty much all the time.
Oh.
Not cooking food properly with salmonella.
Well, that's no.
Okay.
And I don't want one. I see everyone pushing it, and they keep pushing it, and everyone keeps pushing it. I'm sick of corporate America pushing stuff on me.
Sean got some Pop-Tarts. Yeah. Okay, didn't you just tell me that we have to cut down our sugar?
I did.
And you're a diabetic, and you have Pop-Tarts and Fruit Loops.
These are my kidneys are long.
You said kidneys are long?
Kidney all along.
So that's the kidney. This is the lung.
The hospital with her one day, and she wanted to see if she was pregnant. But she said, "Oh, I got a stomach ache," something like that. So it depends.
You go to the emergency room and get a physical? So do you have
sometimes,
a... Yeah.
It all depends.
But how do you think we can get the message out to them?
The way you're talking to me now, each one teach one and spread the news.
All right. I'm Dr. Lisa. I'll see you on the street.
Okay, so we see the impacts of low health literacy in many areas, from adverse health outcomes experienced by patients to the economy, and it even influenced the information environment at large. In this next section, we will explore impacts in these areas. For patients, there are a number of adverse health outcomes associated with limited health literacy, as well as an increased risk. Low health literacy can cause medication errors. If someone is having a hard time understanding instructions for certain medications, they might be having a hard time managing their health in general. Medication errors might be made due to poor health literacy, since only about 50% of patients take their medications as directed. And patients with limited health literacy are at a higher risk of hospitalization, about 50% increased risk, and are nearly twice as likely to be readmitted, about 31.5% versus 14.9%. Health literacy goes beyond just literacy and being able to communicate. Limited health literacy can also affect the ability to fill out complex forms, locate providers and services, which impacts that preventative care, share personal health information such as health history, and manage a chronic disease. Limited health literacy does affect the healthcare system. Patients with limited health literacy may not adhere to medical advice. This can include arriving late for health visits or not showing up at all, not taking prescription medications accurately or at all, and not following treatment plans. It may include the inappropriate use of healthcare facilities and services, as well as trouble enrolling in and using health insurance. Limited health literacy places an economic burden on the healthcare system. Researchers found that limited health literacy accounts for 7% to 17% of total healthcare expenses each year, and they found that an adult with basic or below basic health literacy incurs average costs of $3,362 per year for prescription drugs. Meanwhile, an adult with above basic health literacy has costs of only $910. And researchers found that veterans with marginal or inadequate health literacy cost the system $143 million more than veterans with adequate health literacy. Also, limited health literacy costs the U.S. economy between $106 billion to $238 billion annually. And individuals with limited health literacy have healthcare costs that are 4 times higher than those with higher health literacy skills. So now that you know the statistics and impacts of health literacy, how can you help? There are many effective communication strategies that you can use, and I'll introduce a few of them today. An aspect of health literacy is being able to communicate about health information. For patients with low health literacy, they might not be able to provide their medical history, cannot understand medical terminology, or read written instructions. That's why it's recommended that you use universal precautions. Health literacy universal precautions are the steps you take to assume that all patients might have difficulty comprehending health information and accessing health services, so you treat all patients the same. It isn't always possible to know who's having trouble understanding health information and tasks at any given time, or who's feeling shame or embarrassment because they're having trouble understanding. Health literacy universal precautions have specific intentions. They make it easier for people to navigate health organizations and programs. They simplify communication and confirm understanding, and they help people improve their health. And often when you're caring for a patient, your first interaction involves speaking and communicating verbally with them. So now we'll look over some verbal communication tips. Studies have shown that 40 to 80% of the medical information patients are told during office visits is forgotten immediately, and nearly half of the information retained is incorrect. And patients say that the healthcare environment can make it hard to tell a provider that they don't understand. These reasons are why it is important to communicate clearly. When talking to patients, make eye contact and listen carefully. Slow down when you're talking. Use the patient's words or plain language, which I will discuss more on in a minute. Invite the patient to participate in their care and use teachback and encourage questions. Using plain language is so important. Medical terminology is its own language, and many people do not understand those terms. You can use plain language to ensure that your patient understands the information you're telling them. Sometimes professionals are concerned that using plain language oversimplifies the information, making it inaccurate or worthless. It is important to note that plain language does not mean that you are dumbing down the information. Rather, the use of plain language is used to ensure the intended message is being understood. Using plain language is everyday language. It's also important to remember that you went to school to learn these medical terms, and the majority of the population did not. By using plain language, you're using everyday language. When you are with your patient, it is important to encourage patient engagement in their care. Encourage patients to be involved in the conversation. You can do this by avoiding asking yes or no questions. By asking open-ended questions, they will be encouraged to talk more since they cannot give that standard yes or no answer. It's also important to ask, what questions do you have for me, as opposed to, do you have any questions? If you say, do you have any questions, they will most likely give the standard no answer. By asking, what questions do you have for me, it's like you were expecting a question. The patient might be more willing to ask their question instead of giving the standard no response. Avoid asking the patient if they understand. It could make them feel bad if they don't understand, and then they might be less willing to engage with you after that. Another way to promote patient engagement is teachback. Teachback is a useful tool that you can incorporate into your practice to help ensure information retainment. Teachback can help you improve patient understanding and adherence, decrease callbacks and canceled appointments, improve patient satisfaction and outcomes. When using teachback, you ask your patients to explain what you told them back to you. For example, I want to be sure that I explain your medicine correctly. Can you tell me how you're going to take this medicine when you get home? The patient's response can give you an idea of what health information needs to be explained again. Remember, it's not a test for the patient, but it's how well you communicated the information. You really do not want the patient to feel like they're being tested, so make sure you word to them that you want to make sure you explain the information correctly. So why is teachback important? I'm going to show a little video from the show House.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
So you can see here, that teachback is important to use because it can help you have good catches. What are good catches? It is when you uncover information that would have been misunderstood had teachback not been used. Like in the video, if teachback had been used on how to use her inhaler, the patient would most likely not have ended up back in the clinic, and her asthma may have been better because she was using her inhaler correctly. It's also important to use teachback because many patients say they understand even when they don't, because they don't want to be embarrassed by not understanding. By using teachback, you can see if a patient understands what you just told them. Teachback has shown a positive association of retention. This is especially important since patients tend to forget about 80 to 40% of what is told to them. One study found that patients had a 15% higher retention rate when Teachback was used. And lastly, some physicians overestimate their communication skills. By using Teachback, you can really see how well you communicated the information. So keep in mind that communication is two-way, and you and your patient are a team working towards improving health. Some additional ways to improve communication are to tailor communication to each and every patient by speaking slowly and avoiding medical jargon by using plain language. Communication can also be improved through supplemental materials like videos or diagrams or handouts that the patient can take home with them to refer to. It's also important to focus on the need to know instead of what's nice to know. Try to think, what are the most important things my patient needs to know when they get home? And finally, as a reminder, use Teachback to check for understanding. While verbal communication is an important part in patient care and providing them with health information, written communication also plays an important role. You can use easy-to-read materials to supplement any instructions or vital information you give to patients about their health, medicine, and conditions. Here are some attributes to look for in well-written patient education, or some things to keep in mind if you decide to write your own patient education. The font size needs to be large enough for the majority of people to be able to read, or at least 12-point font or larger. The majority of words should be at least 3 syllables. The majority of words should be less than 3 syllables and written in plain language. If you use medical terms, make sure to explain those terms in plain language. Also, look for short sentences that are between 10 and 15 words. White space is also helpful for the reader. Try to look for materials that contain 50% white space and 50% text. Visuals do count as white space, and they're a great way to enhance the message without relying strictly on words. When looking at education materials with images, consider if someone has difficulty reading, does the image help clarify the information, or does the image make the material more confusing? Look for materials that use headings to separate topics. For example, passages about diagnosis and treatment options should be separated by headings, allowing the reader to distinguish between the two. Patient education materials should engage the patient, and this can be done by using question and answer format. If you have patient education and you'd like to know the reading grade level, there is an option to check it through Microsoft Word. First, you need to add readability statistics to Microsoft Word. Under Options, select Spelling and Grammar or Proofing. Then select Show Readability Statistics. This way, when you run spell check, a box will pop up with the readability statistics. However, make sure to only use Flesch Reading Ease and not Flesch Kincaid grade level. Flesch Kincaid grade level is found to be 2 to 3 grade levels lower than the actual reading grade level. This is the conversion chart. When you run spell check and you get your Flesch Reading Ease number, you're going to get a number between 0 and 100. You will need the conversion chart to find the reading grade level based on that number. You can Google Flesch Reading Ease, and the Wikipedia page has a chart available. So if you run spell check and it says your patient education is a 63, then you can look at your conversion chart and see that your document is at the 8th to 9th reading grade level. So last, we will look at some valuable resources. The first thing I want to mention is the Always Use Teachback website. They have an Always Use Teachback toolkit that goes over more about using Teachback, and it goes over why it's important and different scenarios on using it. It should only take 20 minutes or less. An Always Use Teachback website also has a coaching section in which there are videos on using Teachback and how to encourage others to use it. And there's also a handout on how to coach others. And then these are some various resources. First, I want to mention that I created a health literacy research guide that goes over everything I've discussed plus much more. The research guide is available on Preston Medical Library's homepage. The CDC created a guide called Simply Put to help you write easy to read patient education materials. They also created a database called Everyday Words, which you can use to help you find the plain language alternative to medical terms. And then there's also a plain language thesaurus where you can look through other terms, more medical terms, and find the plain language alternative. The CDC has a health literacy page with more statistics and information on what each state is doing in regards to health literacy. The AHRQ Universal Precautions Toolkit goes over how to use universal precautions, such as verbal communication. There's also the CDC Clear Communication Index, which can help you evaluate your patient education for readability. We can also help you at the library. We provide a free health information service to patients and family members and the community. They can call us or email us or stop in, and we can find them information for we can find health information for them using reliable, easy to read sources. We can mail it to them or email it to them, or they could pick it back up all for free. If they are an inpatient, they can request health information from us through their TV using GetWell. If you have patient education that you're writing and you would like it reviewed, I can review it for plain language principles. I'll find the current reading grade level, then make suggested edits based on plain language principles and find the new reading grade level based on those edits. If you're interested in learning more about health literacy, I can teach a health literacy workshop like this one. Or if you're interested in any research projects on health literacy, please let me know. Please email me at kgrabeel@utmck.edu. And these are the references I used for the presentation today. Thank you.